You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. Sitting in for me today on location is Lori Lecce. She will be interviewing Dr. Ann Nicholas, and if you have a loose-fitting denture or if you're missing one tooth or all of your teeth, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching Live with Lecce. I'm Lori Lecce. Today's topic, what you need to know about dental implants. Today we have Dr. Ann Nicholas with us. Welcome to our program.
Great to be here. Thank you very much.
So tell me about your practice.
We've been at the same location now for over 16 years, and we have a team of specialists that work under the same roof at the same location. We specialize in periodontics, which is gum treatment. We specialize in cosmetic dentistry with a prosthodontist. His department, we specialize in dental implants.
So tell me, what is a periodontist? What do you do?
Periodontist is a general dentist that went to school to specialize additional 2 to 3 years in treating gum disease, dealing with dental implants to replace missing teeth, try to save the teeth, and also doing all type of cosmetic plastic surgery to improve the smile, different grafting procedures to make the teeth look shorter or longer or more useful looking.
Who's your typical patient?
There is not particular typical patient. We have patients that are denture wearers that are unhappy with their dentures. We have patients that want to improve their smile and want to have a better cosmetic look and want to be able to smile more with confidence. And we have patients that are varying age. Some people are in their 20s or 30s. Some people are in their 80s and 90s.
So an 80-year-old can get dental implants?
Yes, yes.
And why would an 80-year-old want dental implants?
Well, nobody's too old to have dental implants. Dental implants can improve their quality of life, improve their chewing ability, and they like to enjoy going out to a restaurant and don't have a denture that's moving around or have no teeth. So, if they're in good health, relatively, everybody's a candidate. It doesn't matter how old you are.
And I understand that you're about to receive a prestigious award. Is that correct?
I'm going to Vegas next week to receive from the International Congress of Oral Implantology at a diplomat status that requires to present a written exam and requires to present 100 implant cases and restorations of before and after cases that have been restored over 2 years that are in function. So I'm excited about that.
I'm Dr. Nicholas's lead surgical assistant. I've been with her going on 9 years now. And it's been such a pleasure and an honor to work with her. She is the best implant surgeon in the Valley here. I trusted her with my own mother, yes. I didn't even need to have any other consultations anywhere else because I just knew that she was the one. I knew that she was going to accomplish what I wanted for my mom, and I brought photos just to show you. This is her smiling because she would never want to show her teeth. Her upper denture, the teeth were just horrible. They didn't look right. They didn't look like they were her own, so she always felt funny to smile. So this is her smile for about 20 years. And she didn't have hardly any bottom teeth. She just had some lower anterior, which was lucky for us because that preserved the bone so that we could put the implants that Doctor placed. And Dr. Nicholas put about 5 implants on the bottom and did a bar overdenture, got her full new upper denture and made everything match, brightened up the teeth, and then this is her a year later.
Wow. And you say she was 98 pounds?
98 pounds, and here she's about 120.
Why?
She was finally able to eat. She can eat apples, she can eat meat again, she didn't have to grind up all her food like baby food anymore. She was able to eat like a natural human being, not like a baby.
She looks years younger.
Yeah, I think she looks about 10 years younger. She just seems a lot happier, yeah. She goes everywhere with us now. Before, she would never want to step foot out of the house when we wanted to take her out to eat or take her out shopping. She never wanted to. She never wanted to buy anything nice for herself. Now we take her to the mall almost every weekend, and she gets herself something nice, and we enjoy meals together now, her and all her daughters, and she just is enjoying life now. Her quality of life is definitely better. She was fearful. She was very fearful, and I think other than that, she didn't think she was worth it. She couldn't imagine spending all that money on a little old lady, and I told her for her 70th birthday that I was going to do this for her, and she didn't believe me, and we brought her in for the consult, did the x-rays, asked Dr. Nicholas if she was going to be a candidate, and she was a perfect candidate, and it was a long procedure, and it took several months for everything to heal and to integrate, but once the final product was accomplished, she was just ecstatic. My mom is just an example of what I get to see on a daily basis. I get to see happy people walk out this door and just have their lives restored because they're able to eat, they're able to smile, and their quality of life goes over the top. And I get to see this on a daily basis, and it's just very rewarding. It's very awesome to see. I think everybody owes it to themselves to come in at least for a consultation so that they can find out what their options are, because so many people are misled and that they're too old. And just like my mom, I'm so glad that she finally came in and saw that you're never too old. You owe it to yourself to be able to eat what you want to eat and to stay healthy.
What are the frequently asked questions that patients have when they come to see you?
Am I too old to have implants? Or, for example, do I have the bone that I need to have implants? Can I have a fixed product that doesn't move around, a fixed bridge or fixed teeth? I don't want teeth that I need to take out. Is it painful? Questions like that, those are most common probably.
You've been on TV in the desert for a long time talking about dental implants. What type of patient would you like to see more of in your practice?
Well, patients that need to get rid of their dentures to be able to have fixed teeth, people that had all their life problem with dental work that failed and had to be redone, and they're kind of discouraged and they have problem with their bite, and they've never been able to really chew comfortably. So that requires sometimes full mouth reconstruction, in which we change and modify the bite to prevent this thing of happening over and over again, that they go and they restore with the hope that this is it, and then it falls apart again. So we would like to help this type of patients that feel discouraged about that, and there is hope. We can improve their smile and be able to chew the way they chewed before they started all these problems.
My background is dentistry. My father was a dentist, and I became a dental technologist, specializing in dental ceramics for cosmetic dentistry and full mouth reconstruction. After about 20 years, we moved to the desert. And unfortunately, I myself had a dental crisis, which required dental implant work. Fortunately, I found Dr. Nicholas. However, before I chose a doctor, and with my professional background, I interviewed as a specialist, but was most impressed with Dr. Nicholas, her treatment plan, her sure and very decisive evaluation of my case, which was difficult, and her dedication to perfection. Well, when it came to the actual surgery, that morning I was a little bit sedated, but before I knew it, my husband was here to pick me up and take me home. I was told by doctor and staff, please not to lay down when I got home, for a little while at least. And so I started to watch television. And then fell asleep or dozed off. But the next thing I knew, I heard my husband walk past, and all of a sudden I jerked up and said, honey, what time is it? It must be time to go to see Dr. Nicholas for my dental surgery. Well, you know what? he started laughing, and he could not stop because he said, "Honey, you had your surgery. It's over and done with."
I was talking to your assistant, and you fix other people's work.
Yes, we have to do that sometimes because the patient is unhappy with the result, and they go to different specialists and checking around what are their options, and because they don't want to live with what they have. And we encourage patients to get as many opinions so that they feel confident that when they choose us, they feel that that's the best, they're going to get the best treatment.
Do you have a typical type of case that you prefer to do?
Well, I like cases that are challenging. I like cases that we can accomplish a great result, that it's actually you can see. I would like to be able to change people's life. It's very rewarding for people that didn't have a lot of self-esteem, that didn't want to go out because to dinner because they felt uncomfortable about their teeth, they didn't like to smile. So, you know, it might be...
Do you hear that often, that you've changed people's lives?
Yes, all the time.
All the time?
And that's very rewarding. That's what keeps me going.
Let's start with the denture wear. How many implants does it take to secure a lower denture?
Usually 4 to 5 implants are the best option. Then even 2 implants can improve the stability of a denture and preventing from moving around. But if you want to have something more stable, then you would use 4 to 5 and for removable. And if patients want to have a fixed bridge, then 6 to 8 implants can accomplish that.
So tell me about the process. What happens on day one when a patient comes in to see you?
Well, they come in for a consultation, which we meet one-on-one, and I listen to their concerns and try to help understand where they're coming from and what their background is and what they want to accomplish. And then we take some pictures or x-rays, different views, sometimes a CAT scan to determine how much bone there is, and we take pictures before and after, how they're smiling when they don't want to smile.
Right.
And we go from there. We discuss the treatment plan. We give them options. I like to give them more than one option. So then I help them to make an educated decision. Basically, it's their decision of what they want, because sometimes what I think is best for them might not be what they want. So I'm trying to, by listening, to understand them better where they're coming from, is to give them what they want.
People don't understand what it is to have a complete, well-done set of teeth in your mouth. You know, that you can eat anything. I looked in the phone book, and I went to 3 other dentists before I went to them and asked if they could do what I asked. And they said, well, no, they couldn't do what I asked. I had dentures was by other dentists, and they last about a year or 2, and I had to have them redone again. The implants I had in there before had broken because they said I had too strong a bite. So I couldn't get anybody to put in teeth that I didn't have to take back out. And I hated getting, you know, going to bed at night and taking them out and getting up in the morning and putting them back in. And I said, I came in and asked Dr. Nicholas if they could do my teeth again so that I'd never have to see a dentist again other than to have my teeth cleaned. And they took about an hour and checked me all over and said, well, we can do what you ask. And
Does it feel like your own teeth?
they feel so good. I've never had teeth feel so good as these two. It was one of the best decisions I've ever made.
Now you have a team approach with dental implants.
Yeah, we have a great team. We have a doctor who is a prosthodontist, and he specializes in all the cosmetic work, changing bite, all the restoration part, and I specialize in the surgical part and dental implants and periodontal cosmetic surgery. So we work great as a team because we have one location. Patients don't have to go from one dentist to the surgeon to do the procedure. This way we have excellent communication about what's going to happen. This way we can deliver better results, and because communication is really important to be able to accomplish that final result that the patient is looking forward to.
And after all was said and done, you know, the outcome and the restorations were just perfect. Puts a smile back on my face. But of course, I want to thank Dr. Nicholas and her wonderful and caring staff for outstanding service, and I thank them profoundly.
What I thought about the most was, when I come home to see my wife and have to take my teeth out and I go around like this and talk to her and everything else, I thought, I don't want my wife to have to look at me as being some Dumbo walking around with no teeth in their mouth. I've had more people tell me that these teeth look beautiful and that they really made a difference in my looks.
Yeah.
So that shocked me, because I had a guy come up to me, he says, God, you look so much better this week than you did last week. He said, what was the matter? I said, I don't know, maybe it's my teeth. He said, well, I don't know, but he said, you look more colorful, you got more color in your face, you look so much better. He said, I can't believe it.
Yesterday I had my teeth cleaned, just like, they feel like your own teeth, so that's a big difference.
What about chewing?
Oh, chewing too, yeah. I mean, there's no difference.
They feel like your own teeth.
Yeah, they feel like my own teeth, and I'm very happy I had it done. I feel younger and more, happier with, yeah.
There are many patients are coming, and their biggest concern, I've been told I don't have the bone, I don't have enough bone, and I have to take bone from the hip, and I have to be in a hospital. So people are reluctant to get started on something that it seems so complex and so complicated and so extensive, and they're scared. They say, oh, this must be really painful. Well, I wanted to know that you can do those procedures many times, not every single case, but you can do this procedure in which you can rebuild the bone, taking bone from your own mouth while you're sleepy and you don't remember pretty much anything. And it's over, and it's exciting because people have something to look for. They started the process. They made the first step to get started, and in her situation, because of the bone that we needed to rebuild and the implants that we needed to place, it took quite a while to be able to get the end result. But now we're 4 years later, and she just had a cleaning the other day.
I smile more now.
Here is who I want to come in my dental office. People that are unhappy with their dentures, they're wearing the dentures for a while and they don't fit, they move around, and they want to improve their looks and an ability to chew.
I saw Dr. Nicholas on TV and was very impressed, and came in to interview her, and she told me what my options were, and it's been great.
I wish there was a way that those people that wear denture were able to try, even for one day, to have the dental implants and a denture secured by the dental implants, for example. And they would see what tremendous difference that makes for their life in terms of their ability to chew and the ability to talk. It's tremendous. They wouldn't want ever to go back to regular dentures.
When I first came in, I had bridges, upper and lower, and they had loosened the teeth they were attached to. Dentures were not an option for me. I wanted implants. I wanted my own teeth. And it's one of the best things I've ever done.
We pride ourselves here in giving patients options. Options about their bite, about their implants, about the number of implants, and I like patients to know what are their options, that it's not one cookie cutter for everybody. It's not one option for everybody. The joints that are involved and the bite that is collapsed, all this play a role into determining what are the options, what's the best option for the particular patient.
I contacted Dr. Nicholas back in October concerning my teeth. I left a message for her on her recorder, and 3 or 4 days later she called me back personally. I was really expecting her staff to call me, and she said that she wanted me to come in and get an appointment with her and maybe have a scan done so she could see the severity of the problem and suggest some alternative procedures. I explained to Dr. Nicholas I had a very serious gagging problem, and in the past the Veterans Administration in Loma Linda had to use IV with the anesthesiologist. And Dr. Nicholas suggested that she could handle the sedation by another method called the pill. And they give you a little powder underneath your tongue, and then they give you a little bigger pill. And about 5 or 10 minutes later, I'm off in dreamland.
Okay, I'm glad you're doing good and you're feeling very relaxed. Now we're going to get started now, and we're going to be starting placing those implants, okay? And we're going to take during the surgery all kinds of x-rays to measure where the implants are going to be so they're in a perfect position, okay? And we're going to start with the right side, and we're going to put 4 implants on this side. Now we're going to get started, and we're going to be placing 4 implants on the right side and 4 implants on the left side. We're going to do a little incision here, and there we're going to start preparing the location to where each implant should be based on our guide. The surgery is going to take about 4 hours to complete, to place them, to make sure that they're all parallel and they're in perfect position. And we're going to be using the stents that we have from the CAT scan to place those implants. Placing dental implants is a very predictable surgery. It has a 98% success, so I believe that this is going to be a great success here, and we're going to be placing on each side 4 implants. He's a great candidate for dental implants because he has plenty of bone, and in his situation we didn't need to rebuild the bone on the lower jaw, so that was in his favor. So we can go straight to placing the implants on each side. So now what we're going to be doing here, we're going to be removing those broken teeth that his bridge broke, and he had few of those bridges that broke over and over, and we're going to get rid of those teeth. And then at the same time that we remove those teeth, we're going to be placing the implants in. Okay, so now we got those models that you see different sizes, diameter. Here they're bigger and here it's smaller, because this model was made from the CAT scan. So now we're able to place the implant exactly where it was planned. So we're going to be putting this stent here, and now we'll be able to go and drill exactly in this location. We're going to be able to make a big difference for Shepherd in terms of what's going to be able to accomplish. He's going to be able to chew. He's going to have a better bite. We'll be able to improve a lot the way his teeth look. And now what we're going to be doing, we just took an X-ray here that we just took. This digital X-ray, not only that they have minimal radiation, we can take a picture in 30 seconds, and now I can see where the nerve is, and we did those measurements, and it shows me that how parallel where the implants, where I'm planning to put the implants, and those are the measurements of where the implant should go to be away from the nerve, and here is where I place the implants. Not all the surgeons that are placing implants have this kind of equipment. 2 years ago we didn't have it, and this makes my life so much easier, because I can take an X-ray that I can see it in 30 seconds instead of 3-4 minutes. And here we need to do a lot of measurement because the nerve here on his lower jaw is pretty close, and we want to be able to place the longest implants, but stay away from the nerve. So this, we can take measurements, and we have the ability to calibrate and take measurements in terms of how far from the nerve we should get when we place the implants. Okay, nowadays with all this new technology, with the use of the CAT scan and the digital x-rays, these procedures are very predictable procedures. And in the hands, all those equipment in the hands of an experienced doctor, then the results are going to be very predictable, and it's very easy for the surgeon to get to that result. Shepherd's feeling very relaxed now. Yeah, everything okay, right? Oh, okay. We just finished suturing, we finished with the surgery, and everything went really good, and Shepherd's going to go home. He's going to have a good night's sleep, and tomorrow when he wakes up, he's going to realize that everything is there and it's perfect. His surgery went very well, and I'm sure we're going to have great results.
I really went through a procedure that I didn't even know that she touched me. I got home and slept for 5 hours and didn't even know I was at home. So I knew that after I woke up that this procedure was going to work for me.
I had no pain. I was a little sore, but I really didn't have any pain from it. A little swollen, but never can I say I had any pain.
I was very confident in Dr. Nicholas in doing this, and when the first one worked, I decided that, well, I think the whole procedure is going to work.
So how are you doing, Shepherd?
So my family is very impressed with my smile, and my wife just loves my beautiful teeth, and it feels wonderful just to have beautiful teeth and a new smile, and it just made me feel good all over. I'm very appreciative of what you've done so far.
Excellent. That's good news. Excellent. I like your smile. Looks good.
It is well worth the expense. I've recommended friends here. It's been one of the best things I've ever done. It's like having your own teeth.
It's just been a wonderful experience from her staff, Dr. Nicholas, all the way down the line. And I'm extremely impressed with her. She has just done everything that I needed to have done from a dental standpoint, performed by Dr. Nicholas, and that was a wonderful experience. And it feels wonderful just to have beautiful teeth and a new smile, and it just made me feel good all over.
So if you're considering dental implants, give us a call and come and see us so you can find out what dental implants can really do for you.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.